I am Mr. Baharudin bin Mohammed from the Open University of Malaysia. Today I will give a talk about the integrated global health. Okay. Integrated global health means combining strategies across prevention, treatment, and policy to improve health outcome nationwide. Instead of tackling disease in isolation, it emphasizes a holistic approach linking infectious disease control with chronic disease management and aligning health services with education, environmental, and community support. For Malaysia, this means strengthening primary care, expanding vaccination and screening programs, and promoting healthier lifestyles, while also using digital health tools to monitor populations more effectively. By coordinating government, healthcare providers, and communities, integrated strategies reduce the duplication, close the gaps in care, and ensure resources and use efficiently. Ultimately, integrated global health is about building a resilient system, one that can respond to outbreaks, managing long-term conditions, and promote equity so every citizen benefits from sustainable health improvement. When we talk about the global health and the dual burden in Malaysia, okay, Malaysia today faces what we call a dual disease burden. On one hand, infectious diseases such as dengue and tuberculosis remain the public health concerns. On the others, non-communicable diseases like diabetes, hypertension, and heart disease are rising sharply due to urbanization, sedentary lifestyle, and dietary changes. The drivers for these health challenges are complex, which with the rapid economic growth, with the aging populations, environmental changes, and the widening health inequality all play a role. This means our healthcare system must tackle both ends of the spectrum, which is preventing outbreaks while also at the same time managing the chronic illnesses. To respond effectively to this situation, Malaysia is adopting integrated health strategies. This includes strengthening primary healthcare, promoting preventive measures like vaccination and healthy living campaigns, and leveraging digital health tools for early detection and monitoring. Collaboration across sectors, which is education, environment, and community engagement, is equally vital. Ultimately, addressing the dual burden requires a balanced approach, fighting infectious disease, and while at the same time reducing lifestyle-related risks, ensuring that every Malaysian has an access to sustainable, equitable healthcare. From the perspective of climate changes, it relates to environmental changes as a health threat multiplier. Climate change is increasingly recognized as a major determinant of population health. In Malaysia, rising temperature, changing rainfall patterns, floods, and air pollution influence both communicable and non-communicable disease. Environmental changes can expand mosquito of breeding habitats, contributing to dengue transmission, while poor air quality increase the burden of respiratory and cardiovascular illnesses. Climate-related impact on agriculture may also threaten the food security and malnutritional health. These interconnected challenges demonstrate that climate changes is not solely an environmental issue, but a public health concern that requires climate resilient and healthcare planning and multi-sectoral action. When we talk about the strengths and challenges of UHC in Malaysia, yeah, the Universal Health Coverage or UHC is one of Malaysia's greatest achievement in public health. The government provide heavily subsidized care through an extensive network of clinics and hospitals, ensuring that more citizens can access essential services without facing financial hardship. This commitment had led to strong health outcomes, which is improved maternal and child health, the longer life expectancy, and widespread vaccination coverage. Yet, universal health coverage in Malaysia also faces significant challenges. The dual burden of disease, which is infectious illnesses like dengue alongside a rising non-communicable disease such as diabetes and heart disease, it places a heavy rain on the system. Okay. Public hospitals often struggle while overcrowding and limited resources, while at the same time rural communities face gaps in access compared to urban areas. Financial sustainability is another concern, okay, as healthcare costs rise with an aging population and advanced treatments. Moving forward, Malaysia must balance this strength with reforms, which is to strengthening the primary care, integrating the digital health tools, and fostering public-private collaboration. By addressing these challenges, USC can remain resilient and equitable, ensuring that every Malaysian continues to benefit from accessible and quality healthcare. Yeah, we are moving towards SDGs as an integrated framework for health equity. The Sustainable Development Goals or SDGs provide a powerful integrated framework to advance health equity worldwide. Goal 3 focuses directly on ensuring healthy lives and promoting well-being, but the true progress depends on the interconnectedness of all 17 goals, which is poverty reduction, quality education, gender equality, clean water, and climate action all shape the conditions that determine health outcomes. For Malaysia, this integrated approach means recognizing that health equity is not just about hospitals and clinics. It's also about addressing social determinant of health, tackling income inequality, improving rural infrastructures, and promoting environmental sustainability and contribute to fair access By combining these strategies across sectors, which is health, education, environment, and economic development, the SDGs encourage collaboration and resource sharing. This holistic model helps reduce disparities, strengthen resilience against global health threats, and ensure that no community is left behind. Ultimately, the SDGs remind us that achieving health equity requires collective action and integrated planning and a commitment to justice in every aspect of development. Now, we will talk about environmental health interconnection. Okay. Environmental health is deeply interconnected with human well-being. The air we breathe, the water we drink, the food we consume, and the spaces we live in all shape our health outcomes. Pollution, unsafe water, poor sanitation, and climate changes contribute directly to respiratory illnesses, infectious diseases, and malnutrition. In Malaysia, rapid urbanization and industrial growth have created both opportunities and risks. Air quality challenges, waste management issues, and deforestation affect not only ecosystem but also the community of health. At the same time, flood and heat wave linked to climate change, which is increased vulnerability, especially among rural and low-income populations. When we understand these interconnections, means recognizing that protecting the environment is also protecting the public health. Okay? With integrated strategies such as sustainable urban planning, clean energy adoption, and stronger environmental regulation will help to reduce disease risk and promote equity. Ultimately, environmental health reminds us that human health cannot be separated from the health of our planet, and safeguarding one ensure the resilience for the others. Building a resilient health system for Malaysia. The key for this is strengthening the primary healthcare, uh, which we will ensuring clinics and community health workers are well equipped to provide preventive and continuous care. It also requires investing in the health workforce, expanding the training and retaining skilled professionals across urban and rural areas. Digital health tools such as telemedicine and integrated electronic records can improve efficiency and access, while the public-private partnership help balance resources and reduce strain on public hospitals. And at the same time, financial sustainability must be addressed through innovative health financing model. Ultimately, building resilience is about integration, which is we combining strong infrastructures, using the technology, using a workforce and a community engagement. By doing this, Malaysia can create a health system that not only responds to crisis but also ensure equity, sustainability, and a long-term well-being for every citizen. This is a key takeaway and a final reflections. Okay, as we conclude, let's reflect on the key lessons. Malaysia's health system faces a dual disease burden, which is infectious disease that remain a threat alongside the rising side of non-communicable disease driven by lifestyle and demographic changes. These dual challenges remind us that health is never a one-dimensional. Okay, a global health framework such as Sustainable Development Goals, okay, provide us with a roadmap. They emphasize that health equity cannot be achieved in isolation. It is linked to poverty reduction, education, gender equality, and environmental sustainability. This framework pushes us to think beyond hospital and clinics toward the broader determinant of health. And most importantly, the way forward is through an integrated, multi-sectoral approach and a collaboration between healthcare providers, educators, the policymakers, environmental agencies, and communities ensures that resources are used efficiently and gaps in care are closed. The takeaway is clear. Building a healthier Malaysia will require a resilience, equity, and integration. By embracing this principle, we can create a system that not only treats disease but also promote well-being, protects the vulnerable, and ensure that no one is left behind. Thank you.